we're still waiting for a Republican, a really strong Republican, to emerge up on the Hill. One of the people I really like is Representative Tom Price from Georgia, but he doesn't have kind of the personal charisma. I apologize if any gets twittered to him at all, but he kind of knows this. And Tom Coburn from Oklahoma has been working and will probably emerge as one of the leaders as well. So in those states, I know we have some people here from Oklahoma. Now, the good news is that's all very depressing, isn't it? Sounds very depressing, and we're being sold that it's going to happen, just roll over. And I was pretty frustrated up until a couple of weeks ago, and that is when we started getting the grassroots movement building that I mentioned earlier, for those of you who have heard it. I had suggested that we do another round of tea parties and that the focus be health care. Everyone's jumped on it. They love it. It has now taken on a life. As I mentioned to you earlier, where there are at least 1,000 events that we know of. We're trying to get a master list of all of them. AAPS is also going to be reaching out to disease-specific groups and talking to patients about why they should be aware of these and what they should be doing. We need doctors communicating with patients, because everyone in DC tells me this time around, last time it was the insurance companies that were sort of the key communicators. This time around, it's got to be doctors. Everybody sees that you have the credibility to do this. You are the ones, you have to start speaking, you have to be willing to communicate with your patients, and I need people signing up and being willing to speak at tea parties. I need you to get together with people about a tea party. Thank you, Dr. Harris. He has to get back home. He has a birthday, one of his family's birthday, and he took his time out to be here today. We need you to be active. So AAPS is pretty good. We don't send you out a lot of action alerts or ask you to do something when we send you out a legislative alert or something. We usually don't ask you to do something unless it's really important. So when we start sending you things, because it's going to get real busy now, President Obama has said he wants something before Congress breaks in August, and he wants to be able to sign something by October. When we start pushing this through, that's when things start to move very quickly. I mentioned earlier, AAPS on June 25th, the anniversary of Medicare, which started the slippery slope, we will have a virtual town meeting for doctors. We'll send you details about that. It'll be web-based, so you can put in your comments and you can participate without having to go anywhere, and we'll be able to you can put in phone tape messages and things like that. So we'll send you details about that in a little bit. The other thing that I found very encouraging was in a meeting with a Senate staffer this week, a key Senate staffer this week. She said that she's hearing that hospitals and state and county meds at the local level are starting to rebel against their national leadership. So if any of you still have hospital privileges or at the hospital, I encourage you to start putting things in the lounges and start communicating, because Dr. Watson told me about an example going on in his area. It sounds like this information is correct. Just like you aren't happy and doctors aren't happy with the leadership of the AMA, the hospitals aren't happy with the American Hospital, the Hospital Federation. Their leadership is not reflecting their members. Now, let's talk about how to talk about it. This is very uncomfortable for many of you, I know, to even try to do this type of communication with patient. We will send you some materials so that you can have something to hand out. You also may be getting requests from patients. The Tea Party people will be going to doctors and asking them to speak. We need you to start to disseminate it out to the patients. I've handed out to you all a sheet with some tips on the language and why some things work and why some things don't work. If any of you have questions, you can ask me about it, but I don't want to go through all of it, except I want to hit a couple of things that are key. Is number one, and this document is, let me how can I tell you? This is a confidential document. It is not to be attributed to AAPS, but you can use the information. What I can tell you about it is that it is from focus groups. The information that I have from there is gleaned from focus groups that AAPS did not conduct, but you can use the intelligence. You don't talk about being against healthcare reform. And as much as I make fun of that word, we can't talk about being against reform. Because if we set up that dichotomy, we say that President Obama and his supporters are for reform, and we're against reform, against patients. So we have to start to change the language. This is going to be key. When you talk about it, you have to personalize. I don't want to hear theory from you. If you speak at a town meeting or a tea party, don't talk about the government shouldn't do this and the government shouldn't do this. It's personalize it. Here's what this will do to my practice. Here's what this will do to my patient. For example, I have an 85-year-old male who, and if we go under a system like the UK, he won't get his bypass surgery. So personalize, personalize, personalize. The way things are won and lost in DC is when people are trotted out to tell their stories. Remember prescription drug coverage? Seniors, dog food, prescription drugs. What am I going to buy? You remember that because they used that. And so, one of the key things that I've talked about is coverage does not equal care. People in Canada have coverage, but they can't get care, and that's really powerful. It's not about health care. The difference in approach, and particularly if you look at the AMA and organized medicine, is that we say there is no single answer. American people are trying to be sold that there is a single answer. President Obama and his Congress are going to come up with a bill that's going to fix things. And we say that's not going to happen. It can't happen. It's like a mosaic. Yes, there are things that can be improved, but they're little pieces that all fit together. And as you put those little pieces together, none seems like the big fix. It isn't the big fix. It won't happen that well. That's not a dramatic sell. That's a harder sell to talk to people. But you just have to keep talking to your patients. I look forward to seeing you out and about. You tell us what works for you to communicate with your patients as we send you out materials, and we'll put things up for you to download. Because this is one of those moments like we had in 1994. We can talk about a lot of things, but if we do not stop the mandate and competitive effective research, and there is already setting up essentially the healthcare authority, a central healthcare authority to make the decisions, then we've lost, and we've lost for generations. So we're in for the fight of our lives again, and I don't think that's an exaggeration. I want to bring Dr. Orient up too for her take, because she is already committed. I think you're going to South Dakota? She's already committed to speak in South Dakota at one of the tea parties. And when you hear AAPS is working, as she comes up, I'm going to tell you, it's kind of messy. I want to make sure that you know that AAPS is not organizing the tea parties. They have a life of their own. We are working with a coalition. We have a coalition of about 150 groups. It's herding cats. But we have a coalition of about 150 groups from the grassroots. And so that's where we're going to win this time.